Hello, hello, everyone. Happy Wednesday. Welcome back. My name is Jennifer Waters, and I believe we are live here at CNY Fertility and CNY Healing Arts. It's been a while since I have joined you all, but I am back in action. And I just realized that March is considered to be Endometriosis Awareness Month. Some of you probably already know that. So I thought that would be a good subject for us to dive into today. It is a very, very common diagnosis. Back when I was your age, it sure was not. No one I knew had endometriosis. No one even talked about it. So now, fast forward 20 years to now, it's so common. We have a lot of information about it in the Western medicine model. I want to talk about the other side of the story that you may not know about, which can help you. So, the first thing is the cause, right? So, those of you that have met me on a Tuesday know that I ask everybody the same questions aside from where do you live? Where did you come from? I'm always curious about demographics. But what have you been diagnosed with in terms of fertility? I'm very curious about what are some common dis-ease patterns that you have so that we can create some protocols in the natural world, if you're interested, that are going to support you on your fertility and healing journey. No matter what, we want you to end up better health wise than when you started, right? So, no matter your outcomes, we want to improve your life, improve your health, improve your emotional well being, all of the above. So, it really helps. So, endometriosis is very common. I didn't realize until, a couple of years ago that it is now in the autoimmune category. And I really thought that that was just in the Western, what I call the disease care model. But in fact, it's not. I did some deeper research into the people that I really respect, including Rosita Arvigo of the Maya abdominal therapy tradition, who taught me a lot about endometriosis in particular. But even she says it's in the autoimmune category, which means the body is attacking itself for some reason. That's a whole nother conversation. I wish I had my little model here to show the location of the uterus and what can happen when you fall off a horse and your uterus, which is normally placed here, suddenly becomes retroflexed, anteflexed, or tips from one side to the other. Remember, the uterus is a suspensory organ. She is designed to grow from the size of a pear to a watermelon, which is wonderful, amazing feat, accomplishment. But it also makes her vulnerable for mislocation. Oh dear, I'm sorry about that. So we want to make sure that your uterus is in a proper alignment. Why? Because every month during your menstrual cycle, you shed endometrial tissue, the lining, correct? Right. And if she is, let's say, retroflexed, if you get cramps, dysmenorrhea, painful periods, and all of your pain is in your sacrum, that is a huge indicator that your uterus is retroflexed to the back. Okay. So that's not a great situation for fertility, to prevent recurring pregnancy loss, but also for that uterine lining to shed. Okay. So, in order for her to fully empty out, she's got to be in a proper position. Let's face it, we want to use gravity to help. We want to use how we are structurally designed to make sure that you are completely shedding all of that endometrial tissue. If you don't, what happens is, I think it's on day 2 or 3 that the new lining actually begins to accumulate. And if the old lining is in there still, the new lining is going to grow on top of it. And that is that brown discharge that you may have at the beginning or end of your cycle. Brown discharge in the beginning or end of your cycle is another indicator that your uterus is not in a great location in terms of your menstrual flow. So we can talk about that heavy clotting, bleeding. That's the liver. It's probably estrogen dominance. Anyways, trying to stay on task here. I only have a couple minutes. So we can, in fact, put her in a better position. Look for an Arvigo therapist. We're going to look at your hips, how they're structurally, are they in place? Is one anterior or inferior? What's happening with your hip rotation? We are going to palpate for your uterus. We are going to look to find her. Is she in a good place? Do you have chronic UTIs? Do you have incontinence? Do you have the brown discharge? Do you have painful periods? Okay, these are all symptoms of a misaligned uterus. So we need to get her in a better position. Okay, so that is the first thing. That is a big, big thing. After you do the Arvigo therapy, and you will learn how to do self-care massage. Maybe one day we can do a little workshop here, either online or in person, and I can teach everybody the self-care massage, which is a wonderful thing to do every day for yourself to keep her in a proper alignment. You want to do some flushing out of the uterine lining also to help detoxify, purify, get rid of that old blood, any old, endometrial tissue that's in there. Let's just begin anew. Okay. You want to have the best possible chances for successful implantation. So we want to have a good lining for that. So back to endometriosis and what happens if you don't shed the lining well is that your endometrial tissue can be pushed out of the uterus, right? And that's exactly what happens. So it's basically things get backed up. There's no shedding. The new lining is growing upon the old, and it becomes such an excess condition that the tissue is pushed out of the uterus. And so that's what endometriosis is. So on the one hand, you can think, well, that's not the body attacking itself. That's just a structural issue. Yeah, exactly. Exactly. But I think because the condition, no, that's the cause. One of the causes, location. But the condition is such that there's a lot of inflammation, there's a lot of other things going on. So then it becomes a high inflammatory response. And this is what happens when the body starts attacking itself. Then you weave in negative emotions, negative subconscious thinking, and you're really set up for a serious situation, which the Western medicine really only treats the pain, right? There's some wonderful pharmaceutical drugs out there for the treatment of the pain of endometriosis. They do not talk about the cure or the cause. It's just how to minimize the pain, which sometimes you've got to be in that situation. Let's decrease the pain as quickly as possible. So in terms of treatment modalities, what can you do? Arvigo, right? My abdominal therapy. You can do acupuncture, definitely is going to help, not only with the pain, but give your body the energy that it needs to help get her in the proper position and then maintain that proper position, which is a really important part of preventing miscarriage. Light therapy, LED light, depending on your fascial layer, we can use light to go directly into the uterus to help her not only detoxify, but give the ligaments the strength to put her in the position and stay there. In the phototherapy world, we've got a couple options as well. The YH Eon patch, this is good for inflammation, decreasing inflammation. It's very easy. You take the patch, you stick it on. That's it. You drink water. The Ice Wave patch, also very, very good. This treats the pain and inflammation. Really helps, better than ibuprofen. Sometimes you need both, and then there, of course, there's a hormone imbalance issue. There's a spleen weakness. If we get into the traditional Chinese medicine diagnosis, the spleen is always, always involved. The spleen holds things in place. The spleen holds things, the blood in the vessels. So when the spleen is weak, things go awry. So we want to strengthen the spleen. And that is one way into hormone balance as well. So we have the spleen 6 patch. This is for hormone balance, among many other things, appetite, digestion. Some people use it for weight maintenance and all of that. All right, folks, that's it for now. I have to go. It's nice to be back. I'm going to put my website here. Please reach out to me. I hope that I was able to answer some of your questions. And if I can figure this out, I will put it on